This case is from a 42-year-old woman who presented to her physician complaining of pain on movement of her elbow. Radiographs showed a large tumor involving the distal humerus and the adjacent soft tissues. A biopsy was performed, which was followed by a subsequent excision of the mass, including the distal portion of the humerus and soft tissues. The slides represent sections taken from different portions of the specimen, as well as some immunohistochemical studies that were performed. The neoplasm expands into the soft tissues and grows with a predominantly pushing margin. The tumor appears to be multilobular and has a pale blue to pink background. The pale blue background at low power indicates that the tumor has a prominent myxoid matrix. Myxoid tumors have a basophilic to pink foamy stroma within which the neoplastic cells, whether they are spindle, stellate, and sometimes round, appear to be floating within the extracellular mucinous stroma. There are a variety of different bone and soft tissue tumors that have a prominent myxoid matrix. Note the size, shape, and arrangement of the neoplastic cells. They vary from spindle shape, which I define as a cell having its long axis at least twice as great as its short axis, as well as cells that are round. The neoplastic cells in this tumor appear to be ranged either in an isolated fashion or oriented in chords or forming small, solid clusters of neoplastic cells. The fact that the neoplastic cells are back to back with their cell membranes closely opposed to one another can be helpful in distinguishing certain kinds of myxoid neoplasms from one another. For instance, this arrangement is common in tumors such as mucinous adenocarcinoma and chordoma. This arrangement is not seen in primary bone sarcomas of chondrosarcoma, namely myxoid chondrosarcoma. The neoplastic cells are relatively uniform with regards to their cytologic features. The nuclei are either somewhat oval or round, have fine chromatin, and small nucleoli. There is no significant pleomorphism. There is relatively little mitotic activity. Note that some of the cells have eosinophilic eccentric cytoplasm. The tumor has abundant stroma, and appreciate that there are very few stromal or supportive blood vessels. This is important because some neoplasms in the differential diagnosis, such as myxoid liposarcoma, have a prominent branching vascular pattern. The combination of a myxoid and basophilic stroma, round and spindle cells growing in cords and solid clusters, raises the possibility of a neoplasm known as extraskeletal myxoid chondrosarcoma. It is a descriptive term, extraskeletal referring to the fact that the tumor most often arises in the soft tissues. The term myxoid chondrosarcoma refers to the fact that morphologically it resembles a primary myxoid chondrosarcoma of bone, but molecular studies have shown that these tumor cells do not show a cartilaginous phenotype. Therefore, the term extraskeletal myxoid chondrosarcoma is erroneous with regards to its phenotype, but the diagnostic term is still being used because of its long history and tradition. It is recognized, again, that the tumor is not a true chondrosarcoma. Extraskeletal myxoid chondrosarcoma differs immunohistochemically than primary myxoid chondrosarcoma of bone. In